Okay, sure. Okay, I hear lots of rustle of potato chips. Can you guys hear me okay? Good. Well, I'm excited to talk to you today. I'm Laurel Brown. I'm a cardiologist, so I spend all of my time thinking about heart health. And I realize that sometimes when people start to hear about heart health, they can start to feel like guilt and shame piled upon us because we all feel like we're not doing enough or we're not doing what we want to be doing in terms of our health. But I have 3 goals for today. The first is that you'll walk away with some knowledge and feel like you actually understand when we're talking about heart disease and heart health, what do we actually mean? And this might be new to you and it might not be, but hopefully you'll walk away feeling like I have a real handle on what this means about my heart health and for me in particular. My second goal is that you'll walk away feeling encouraged that there are actually things you can do to be heart healthy and that it's not as difficult, overwhelming, or impossible as it may sometimes seem. And then the third thing is that you'll also walk away with an important skill, and that's actually bystander CPR. So you notice that we have mannequins set up, and that's not just for the ambiance of the room. It's actually because we're going to teach you an actual practical skill today. And the reason we're rolling this all into one is mostly because I'm really passionate about bystander CPR, and it's a way that we can all make a big difference, and because y'all wanted to hear about heart health. So we're just going to roll it all into one, and hopefully it will be a seamless transition. So for my benefit, just show of hands, does anyone in here have a clinical background or a current role clinically? Okay, a few, very few. Okay, good. That means that maybe what I'm going to tell you is new and interesting to you. So when we talk about heart health, it's sort of this big, vague term, and you probably see commercials on TV and hear about healthy heart and all this stuff all over the place. But there's actually a lot of different flavors of heart disease. That's why there's all kinds of different cardiologists. But there's one main type that we're going to talk about today, and that's what we call coronary artery disease. This is the part where you feel awesome because you have potato chips in your mouth while I'm showing you cholesterol. Sorry, that's how it goes. So the main type of heart disease that is the #1 killer in America, and thanks to the westernization and globalization of the Western diet, it's becoming the #1 killer worldwide. What we're talking about is buildup of cholesterol inside the arteries that supply your heart. So to get blood everywhere inside of our body, arteries carry that blood and carry oxygen with it. What happens over the course of time, due to cholesterol, diet, lack of exercise, family history, and genetics, which you can't really fight, is that cholesterol can build up inside the arteries. And slowly over the course of time, as it builds up, it becomes narrower and narrower and harder to get the blood to the heart muscle. When people get angina, you ever heard that word before, or people heard having chest pain? Anyone here know someone who's had a stent before put into their arteries? Okay, so this is raising familiar thoughts. Well, that's all because this eventually gets to the point where you're not getting enough blood flow to the heart muscle. When there's not enough blood flow to the heart muscle, one of two things happen. Either you get some chest pain because it's not enough blood flow when you're exerting yourself. That's the kind of thing for which you put in stents into people's arteries. Or if it all at once becomes blocked or becomes narrow enough, then that's what leads to a heart attack. So a heart attack is very simply just not getting enough blood flow to the heart. But so I treat heart attacks. I'm a critical care doctor, so I spend all of my time in the ICU taking care of people who've had heart attacks or almost had heart attacks. But really, if we were doing our job as cardiologists and as a society, I would be out of a job, because really the best treatment for this is to prevent it in the first place. So when we're talking about heart health, what we're trying to do is prevent this process from happening. Now, I do have a piece of bad news, and that is that if everyone is over the age of 18 in this room, I assume we all are, we've all already got this. Me too. I'm a cardiologist and I can't escape it. So over the course of time, we all get cholesterol buildup, and it starts pretty early in life. But the good news is that we can actually modify this, we can slow it down, and we can even reverse it with some of the things that we do and the ways that we treat our body. So a lot of the things we were just hearing about with these wellness initiatives, actually a lot of those things have been proven to slow the progression of the buildup of cholesterol and to also potentially reverse it. And so that's what we're going to talk about today, is what we can do for ourselves and for the people around us to try and prevent this from happening, and really to try and prevent heart attacks. Oh, I skipped forward too fast. Okay, there's mostly women in the audience, so I'm going to actually talk to you about this for a second. So one of the misconceptions that women have is that, oh, well, heart attacks are what happen to men. I don't know if that's in your mind or maybe from seeing what used to be on television before. We've done a really good job in recent years of trying to increase awareness. But what a lot of people don't realize is that heart disease is actually the #1 killer of women also. Most women are afraid of breast cancer. That's sort of at the top of their list of what they think will happen to them in their lifetime. The statistics tell us 1 in 8 women will get breast cancer, but 1 in 3 will suffer from heart attack, stroke. And the stroke is the same thing as a heart attack, it's just in the brain instead. So same process. Buildup of cholesterol, not enough blood flow to the brain. So this is actually a major problem for men and women. The number for men, are worse. 1 in 2 men will die from heart disease or stroke. This is a major problem in our society, and women sometimes don't know that they're also at risk. And traditionally, women are the one who are making sure their husbands go to the doctor, making sure their children go to the doctor, and then women go and see their OBGYN and maybe never see another doctor again once they're done with their childbearing years. And so this is really important because actually a lot of the risk factors that lead to this cardiovascular disease are totally silent, so you have no clue at all. So there's some really important things to think about and to get screened for you. This is another important topic here. Really, this is what's happened in our society. We have a lot of focus on breast cancer, which is really important and really great, but then the message sometimes gets lost that a woman is 10 times more likely to die from heart disease than from breast cancer. Am I depressing you yet? Don't worry, there's going to be good news too. I'm just trying to drive home how important this topic is because a lot of times we just don't realize it. Women get heart disease later on in life. So men, the average age is around 55. For women, it's around 65. So we just don't think about this. It's not at the top of most women's list of what's going to happen to them in their lifetime. So then it becomes low on the priority list. And by that point in time, the cholesterol is already built up in the arteries. So what are some of the things that you need to know for your own healthy heart? Well, first of all, knowledge is power. So ignorance is not bliss, and not knowing and just turning a blind eye and never going to the doctor because you feel fine, probably not a good idea. I say that to myself, I don't have a doctor, so I'll just confess right now. But I am one, though. So we all need to have someone who's looking after us. So I like this graphic because it talks to us a bit about the 5 different numbers that you can know to think about what your risk is for heart disease, okay? So we all know about weight, body mass index. So this is a way of understanding weight and height related. And so not just your actual number in weight, but how that's related to your height. This is something that can be calculated very easily if you find an online calculator. And we know that if the higher the body mass index, the higher the risk of developing heart disease. So weight is an important one to keep track of. Secondly, this is something interesting that we've learned over the last decade or so. So distribution of weight also matters. We know that, we always talk about different body shape and when we go shopping and what kind of clothes we want to wear. But there's actually different body shapes that are more likely to develop heart disease, and that's when the people who carry their weight centrally. So we actually look at the waist circumference as another risk factor because some people have skinny legs, but they carry their weight in the midsection, and that's actually a higher risk of developing heart disease than if you just distribute the weight all over the body. So that's an important number to know. The third number is blood pressure. This is a really important one. We call blood pressure the silent killer. Now, blood pressure fluctuates through the day when you're facing a deadline, when you're stressed out at work, when you're frustrated with your children. Blood pressure can really skyrocket, but we really are talking about the average blood pressure over time. And so getting the blood pressure measured regularly is really important because this is so easy. Okay, fighting weight and waist size, we know those are more difficult things, but fighting blood pressure is so easy. We can change our diet, we can reduce the amount of salt in our diet, or if you can't get your blood pressure down, we give you a pill. So this is a risk factor that we can completely modify and basically eliminate. This is an important one to know, and you only know if you go to the grocery store and check your blood pressure or if you go to the doctor. I recommend the doctor because this is not accurate in the grocery store. Next one is the cholesterol. There's been a lot of understanding of cholesterol that's developed over the last many decades, but again, you can't know this just from sitting around. It's not like you're going to say, oh, yep, I think my cholesterol is high today. You have to go to the doctor and get it measured. Cholesterol is a huge and important risk factor, and again, we can do something about this. Yes, diet, exercise, all crucially important, but if you can't quite get there or you're still working on it with diet and exercise, again, we can treat this medically. And if we can control cholesterol, blood pressure, and the final one, blood sugar, we can really reduce someone's risk of developing heart disease. So now the fifth one is blood sugar. Again, this is diabetes, which you've probably heard about. And yes, you can get symptoms when you're at the extremes, but you could have diabetes and never know it because you're not feeling it. So in particular for those last 3 that I mentioned, that's why going and getting screened is really important. And this would be as part of an annual routine screening at the doctor. And again, really easy to do something about these 3 things. Okay, are we still feeling depressed? Everyone feeling like, oh gosh, I have to go to the doctor. Okay, but let's go back to the first 2. Let's talk about weight, waist circumference. So there's a lot of stuff that we can actually do to try and improve our heart health. And you heard a little bit about it already. Kind of my thunder was stolen. Taking the stairs. So these are some of the things I like to tell my patients that are easy to start with. take one flight of stairs. I myself started doing this about 6 months ago. Our offices are on the 6th floor, but there's only 4 flights of stairs. At first, I felt great about myself because I was like, yeah, 5 flights of stairs. I'm a little winded, but that's okay. And then I realized there's no 3rd floor. So it was actually only 4 flights of stairs, but that's better than 0 flights of stairs, right? So taking the stairs every day, wherever you are, or at least take half the stairs. These are manageable goals that can honestly make a big difference. Just like you already heard, sedentary lifestyle, sitting at our desks all day, we actually are now learning just how much of a risk factor that is. So getting these text messages, getting up and walking around, take your lunch break, go walk around outside, get some sunshine. That's also good for you, right? People are like flowers, water, sunshine makes us feel good. So these small things can actually make a big difference. And I don't know if you're like me, I'm a pretty extreme person. So when I start to think about, oh, I got to exercise, in my mind that means I need to become like Katie Ledecky. And if I don't become no, Olympic fans, yes? Okay, Michael Phelps. We all know who that is, right? I saw him once. I used to live in Baltimore. I saw him once. I think, oh, I have to suddenly become like amazing an athlete. No, actually, just these small amounts of exercise, getting out and walking, getting a little bit, 20 minutes 3 times a week, those actually make a difference. And it's not just because we're saying that to like pat you on the back and make you feel good. No, these things actually do make a difference. And in large studies of thousands of people, we've shown that it reduces your risk of developing heart disease. So small, manageable steps, setting those goals, these things can really help to impact your risk of developing heart disease. Now, question. Who here has a family member who's had a heart attack, stroke, or heart disease? Almost everybody, right? We can't escape our family history. We can't escape our genetics, but we can modify all of these other things. Now, there's one thing on this list that is not on this list that's really crucial for Kentucky, and that is smoking. So I lived in Baltimore before I moved to Kentucky a couple years ago, and I thought that I had seen, smoking, but man, it's different here. It is a whole thing. I ask my patients, when did you start smoking? They say, I don't know. I'm like, what do you mean I don't know? I know, it was around age 5. I'm like, whoa. So my eyes have been open to just how big of a deal that is. And again, what's interesting is, I think everyone's familiar that smoking and lung disease, smoking and lung cancer go together. What's very interesting is that smoking and heart disease also go very strongly together, which you may have heard that as well. But here's the cool part, at least from my perspective. When people stop smoking, they can actually reverse all the damage that's been done to the heart. That can actually be reversed. And if you quit smoking for the next 7 years, by the 7th year, the damage that did to the heart is actually probably reversed by that point. And that's different than the lung cancer risk. But from the heart perspective, it actually does make a difference. Because some people will say, I've been smoking for 30 years. What does it matter? It does actually matter, because just by stopping, you can actually decrease that risk. So that's a crucial thing for friends, families, loved ones, us, if anyone's still smoking. Quitting tobacco is the first and primary thing I try to teach my patients that can really reduce their heart disease risk. One comment on the blood sugar issue that also plays into weight. So we're all looking for things that we can actually do to make a difference. So another really small and easy thing is look at what you drink on a daily basis, because we don't realize how many calories and how much sugar is hidden in our beverages. So that's even when you think, oh, this is a diet tea, so that's fine, that actually still changes the way our body regulates our blood sugar. So take a look at what you drink. That might be an easy way to cut out 200 calories or more a day. And just by doing that and taking 1 flight of stairs alone, right there you can probably be rid of 300 calories that you otherwise wouldn't be rid of. So small, manageable goals, but done over a long course of time, these things can make a big difference. Okay, so any questions about heart disease and risk for heart disease based on what I've just said? Is this news to you, or you've heard all this stuff before? Okay, it's not that new of information. Sometimes it's just good to hear, and it's actually possible to do these things. It really is. Any questions, yes, on that? Okay, so now we're going to move to the bad news, but also where you can also make a difference. So what happens if someone has a heart attack and they actually end up with cardiac arrest? Well, I want to first tell you what cardiac arrest is. This is sort of the worst case scenario, worst outcome that could come because of that blockage I showed you in the artery. So if a blockage in an artery gets severe enough, then yes, someone can have a heart attack. The blood flow gets cut off to the heart muscle, so they end up with a heart attack. But sometimes, not all the time, but sometimes when that happens, the heart can actually stop beating, either because the heart attack is so large or because the electricity of the heart becomes unstable when someone's had that muscle deprived of blood flow. And that's what a cardiac arrest is. So they're not the same thing, but they are related to one another. So if and when a cardiac arrest happens, this is actually what I specialize in and what I spend my time doing. But I can't save everybody who has a cardiac arrest because 70% of them happen in the home, and they happen outside of the public arena. So many of us here in Louisville are very passionate about this topic because you are the hands and feet. You are the first responders. Even though we have our EMS here, our EMS are first responders, they're actually second responders because family, friends, people who are in public, you are the first responders. And particularly if you live in home with someone who has heart disease, elderly relative, etc., this is really something that's crucially important for you to know. Because for every minute that someone's heart is stopped beating and they don't get CPR, their chance of survival drops by 10%. And I don't know how good our ambulances are, but they certainly can't get there in 1 minute. That's not possible, right? So cardiac arrest is something that you actually can do something about. I think there's this misconception because we see it on TV. Actually, someone has studied this. On TV, when someone has a cardiac arrest, they clear, and everyone shocks them, and then they always come back, right? I don't know if you watch medical shows, but someone did a study of these and showed that 90% of victims survived cardiac arrest in the hospital. Do you know what it is in real life? So in the in-hospital world, our best is between 25 and 40%. In the out-of-hospital world, the best anyone ever gets is 30%, but it's really closer to about 15 to 30% in this country of people survive. So that's not like what you saw in ER. And George Clooney never shows up, let me tell you something. I do this for a living, and he has never shown up a single time. So we need an entire city. We need an entire country that's blanketed with people who know the very, very simple steps. The very simple steps that we can do and that literally can save someone's life. Okay, this is getting personal now. Has anybody ever done CPR? Anyone ever done CPR on a real person? Okay, a few of us. I know it's not an easy thing, but in honesty, this can really save someone's life. And I think a lot of times we think, oh, it's complicated or I don't know what to do. So that's why we're going to arm you with knowledge today, because just like you always learn from those, remember those G.I. Joe commercials, knowing is half the battle, right? Remember that? Okay, maybe that was my childhood. Knowing is half the battle. Knowledge is power. So we're going to arm you with knowledge today. There are only two things you need to do if someone has a cardiac arrest in front of you. Only two things. The first one is call 911. Get our friends from EMS on the way who are going to come and help you. Get a professional on the way. And then you push hard and fast in the center of the chest, and you push to the beat of the song, Staying Alive. Everybody knows that song, yeah? John Travolta, Saturday Night Fever. Okay. When we teach this to some of the new high schoolers, they're like, I think I've heard of that song. Oh my heavens. Okay, so the other one you can do is dun 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 dun. Right? Start. Okay. So the Darth Vader theme song is actually at the appropriate one. That's good, right? Did you not know that, Janice? Oh, that's my singing. That might be my singing and not you. Okay, so that you have to have this song in your mind, and you're going to push hard and fast in the center of the chest. That's it. And then you just wait for the professionals to arrive. No rescue breathing, no mouth to mouth, none of this concern. All you do is just get the blood flowing to the brain. We actually know that that is just as good as trying to do rescue breathing, trying to do mouth to mouth. You don't have to worry about any of it. You just have to push hard and fast in the center of the chest. Now, this is so important because, again, like I said, for every minute that the brain goes without blood, the survival decreases by 10%. So by the time that the paramedics arrive, this is really crucial that someone has started CPR. And by the time they get to me in the ICU, the only time that they've ever survived is if someone started CPR. And the only way that their brain ever survives is if someone started CPR. So one of the kind of discouraging things, to be honest with you, is that we're not very good in our area at bystander CPR. So this is a map that shows, it's just giving you by color coding, the rates of CPR training in the United States. Okay, so we're right here, yeah? So the light squares are the lowest areas of CPR training. And we're okay right up here, right? And we'll do that so it covers it all up. We're all right. But in this county alone, our rates of people actually doing bystander CPR, they're very low. And they're lower than other places in the country. So that's why many of us, my friends from EMS, myself, many other people in this county, in this city, are so passionate about getting people taught. Because you may never use this skill, and I hope you never have to use this skill, because it's a little bit traumatic to witness something like this. But if you are there, you can honestly be the difference between someone walking away, surviving, and someone coming to me in the hospital, and then I have to talk to the family about the fact that they're never going to wake up ever again because their brain is dead. That's a conversation I have very frequently, and I don't like having it. So we're trying to train as many people as possible because you literally can be the difference between life and death. So with that, that's my best friend. Go Cards. I'm going to turn this over now to you. You're going to actually learn how to do CPR. So you're going to get a little exercise, burn off those potato chips, okay? And we're going to actually teach you how to do this today because if you've practiced it, you'll have something in your mind should you ever be called upon to do this. All right, with that, I'm going to have our wonderful friends come and give you some information.
I'm a paramedic with Louisville Metro EMS. And what we're going to do today is learn how to do hands-only CPR. And like Dr. Brown said, if it's done correctly and done as soon as the cardiac arrest event happens, you did increase the chances of survival. And I can tell you now that here in Louisville, our survival rate, we're doing pretty good. We are seeing a difference, and typically your patients do go home with no neurological deficits, and that's great. So we kind of want to keep that heart circulating. So tell me what you know about hands-only CPR. Anybody? What am I doing? What's the whole purpose of it? What's the goal? Right. So why are we doing hands-only versus no more mouth-to-mouth for a first responder? Basically, when that person collapses, right, they take a last breath. So there's still oxygen in their lungs, there's still oxygen in their bloodstream. And it's not that red blood cells store oxygen, but they sure as heck carry it, right? So we just need you to keep that heart circulating the blood. That's all we need you to do, okay? So, and speaking on that, has anybody ever been certified before in CPR? Okay, so quick quiz here. Who needs it? Who needs CPR? How do I know when to do it? What's the criteria? Unconscious, unresponsive, does not appear to be breathing, okay? So if this person was to collapse, let's just say we're at the waterfront, we're out with our family or we're our friends, this person collapses, our first response is to do what? Hey, are you okay? Oh my God, he's not breathing. Go get help. Call 911, get an AED, do something, right? Stop staring at me. Because what's your general public typically doing right now when this happens? What are they doing? They're filming you. Yes. You're on Periscope. Yeah. You're on YouTube, Periscope right now as we speak. So you got to put them to work, okay? Because they're just as enthralled about this as you are. So put them to work, send them to go call 911 or get help. The first thing you need to do is open up the shirt, right? They don't appear to be breathing. I was just looking for chest movement. No more listening, head tilt, chin lift, listen and feel. Remember that little routine we had to go through? We're just looking for chest rise. So doesn't appear to be breathing, and typically I'm on my knees, which I'll give this demonstration in a minute on the floor. But find my hand placement. Does anybody remember where hand placement is? Right, so kind of feel along where the ribs join together, and it's 2 fingers above where the ribs join together, okay? The reason we want that is that puts you almost at the center of the chest on the breastbone. We want you to kind of stay away from that very end of the breastbone. There's a little bitty bone down here. It's called the xiphoid process. It's triangular in shape. If you're down too low, you can snap it off doing compressions. It could puncture the heart, the liver, the lungs. We've already got issues with him. We don't need to make things worse, right? So no pressure there, right? 2 fingers above where the ribs join together, heel of the hand, and then how far down do I push? My certified people? 2 inches, right? 2 inches in depth. Now, I've heard a lot of people like, oh my gosh, our rib's going to break on this patient if we're doing compressions because I got to fix this myth. Are they going to break? Right, and it's not ribs like poking out or anything like that. It's just a separation of cartilage around the sternum. That's all it is. Will it heal? Yeah. What do we do for broken ribs? Nothing, right? Put a piece of tape around them, band them up. Hopefully he'll get to go home. But, so 2 inches in depth, right? How fast do I need to go? And I'm staying alive. But the newest rate is 100 to 120 beats per minute. So you are moving. But a word of caution with that. When you're doing these compressions, you can't just keep the heart compressed down here, right? You've got to make it smooth and even and allow the chest to recoil so that it fills back up with blood. The heart fills back up with blood so that you can squeeze it out to the rest of the body, okay? So that's the whole idea of hands-only CPR. It's just for you to stay on the chest until you get tired, which you will, Okay? So what do you do when you start to get tired? Remember those bystanders that were filming you? Okay. You need to start talking to them, okay? Hey, do you know how to do this? I'm really getting tired. You need to coax that person down to you, because once you start to get tired, your compressions become less effective, right? So you get them to kneel down across from you. Never straddle a patient, okay? CPR is not as effective at this angle, and family won't like you if they're there. I'm just letting you know now. So kneeling next to the patient, got to start talking to that bystander. You know how to do this? Get them down across from you. On the count of 3, we're going to switch, okay? 1, 2, 3. I get off, you get on. That's true hands-only CPR. But see, not the whole public here in Louisville is trained on how to do this, right? So you may become that instructor now. So if they start off down here, what are you going to tell them? Got to move up. You know, this is the difficult job of being an adult, is talking to another adult. You're going to see that in a minute. Do you all know each other in here? Good. That's great for our next exercise. Okay. So if they start off down here, you're going to tell them to move up, right? So speak up. Make sure they know. You may have to put their hands up a little bit. What if they're doing that classic TV CPR, which kind of looks like this? What are you going to tell them? Right. Right. Tell me you need to speed up, right? And yes, the Bee Gees, Staying Alive. Another 100-beat-minute song that's out there, another one, Bites the Dust, is not as appropriate to be singing or humming during this time, okay? It's just not going to work. That's not appropriate. So, but you might have to tell them to speed up a little bit. So you become the instructor. So not only are you already the first responder, but now you're the instructor too, okay? So we're going to do a little exercise here, which is going to require people to get down on the floor. If you can't get down on the floor today, you have knee issues, hip issues, back issues, I'm okay with that. We can set a station up at the table. I would rather you learn how to do this so that you may be able to, instruct someone else if you needed to, versus not participate at all, okay? Now, the other thing is, I need to tell you, is when we do this exercise, you need to remember that we want to keep less than 10 seconds off the chest. Why is that? Why do I want to keep less than 10 seconds to either switch off with you or, to maybe put on pads or whatever, but why less than 10 seconds? Do what? Yeah, I want to keep everything moving. Because what happens to the blood flow when you stop compressing? What happens to the blood flow after it sits in the vessels for about 10 seconds? What's it do? It clots. So then, 30 seconds later, what are you now pushing? That's where those chances of survival just went down, okay? So we kind of like in EMS, we like to tell you the whys and the reasons why you're doing this stuff, because maybe if you're thinking this way, you're more likely to do something about it, right? So if we're switching off and you're taking your time getting down here, I'm not going to let go until you're ready, right? So then the question is usually asked, well, what if I'm by myself? What if I'm at home? Okay? So you go out to check the mail, right? Your neighbor who's across the street, the one that you like, right? He collapses. You run across the street. We are in the age of cell phones. Typically, people have theirs out looking for Pokemon. But you need to put that cell phone out on the ground, call 911, put it on speaker, right? You're like, hey, are you okay? Oh, my God, he's not breathing. And there's nobody around, right? You start compressions. Dispatch is on the phone. They're kind of guiding you through it anyway. But after about 2 to 3 minutes, and I promise you, you're about to see it, you're going to get tired. You're going to get winded. Nobody's here to switch with you. What are you going to do? Exactly. Less than 10 seconds, right? There's no one else out. You're becoming less and less effective, right? Stop. Take a breath. But I would be counting to 10 during this time. And as soon as you hit 10, get right back on the chest, right? Stretch, whatever you have to do. Because we're not superheroes. None of us are. We're going to get tired doing this. And in a few minutes, you're just going to see about how tiring it can be. We're going to split up into groups in a few minutes, and I'm going to give you a scenario. And everybody in your group is going to be your bystanders. And it usually gets pretty creative and chaotic during this time because this is your opportunity to become that actor, that actress that you always wanted to be. Okay? Yeah, there you go. So, because I want you to play that difficult bystander. Okay? I want you to play that person who maybe just doesn't know how to do this. You want to help, right? And so she's asking me to switch off, and I'm like, okay, right here. You need to be able to tell that person where to put their hands or how fast to go, okay? So think about the role that you're going to play, and no one has to say what role they're going to play in their group. But it gets really interesting. I trained Center College, the theater arts students over the summer. It got very dramatic. During this part of the exercise, one girl was doing CPR, another guy who was the bystander was like, girl, you look good doing compressions. Can I get your number? I mean, you can be as creative. And the thing is, do you think I'm not exaggerating, right? I've been in EMS since 94. Yeah, bystanders, sometimes this is not registering to them what's going on. So, but you got to stay focused, right? I've had people, simulate vomiting, like they just can't do it. But I need everybody in the group to take a turn, okay? So no matter what role you play, if you're weeping and wailing that this is your brother, and then they tell you you don't have a brother, you need to, get on the chest at some point, okay? So it's going to be some fun. Now, this mannequin, I want to show you. It's my new little toy. I'm going to kind of walk through this little scenario, and I'm going to have my good friend, Kevin Martin, be my accomplice, okay? So, but this is what you're going to do. Now, in your groups, these mannequins that you're using light up a little bit differently than mine does. But I'll show you how to use it in just a second. So in your group, in a few minutes, this person's going to collapse. We'll be at the waterfront. Is that okay? How long do you think it would take EMS to get to the waterfront? Now, be kind, because I'm controlling the time of this scenario. So it could be 8 to 10-ish minutes, depending on where we're coming from, right? But out in the county, anything goes, right? So we'll be at the waterfront today. So in your group, whoever's going to start it, and you don't have to announce it in your group who you are, because I want it to be as natural as it happens, or as the scenario progresses. But I'm going to say, go. This person's, he was having chest pain. He just collapsed, right? And just one little detail I wanted to bring to your attention. Hands-only CPR only works for those who, it's not a choking or a drowning or some kind of breathing issue, because if it's that in that category, they need air, right? That's what caused this mess. But American Heart does say that if all else fails, if you just don't know how to do ventilations, just do compression. So they give you that open door for anybody, okay? But this person, he was just, complaining of chest pain. He collapses. So in your group, somebody needs to be that first responder, right? Don't announce it in your group who you are. Just react, okay? I'll say go. You're like, oh, my God. Hey, are you okay? Holy crap, he's not breathing. Go get help. Call 911. Get an AED. Stop filming me. And then find your hand placement. Open up their shirt, raise up their shirt, find your hand placement, and then start to compress. Now, this mannequin lights all the way up to the brain to show blood flow, right? So, but as I start to get tired, look what happens. Leave it off for just a second, if you can. Just for a second. Yeah. So as I start to get tired, right? Everybody's just standing there watching me, kind of like you all are right now. Am I getting circulation up to the brain? No, right? Hey, do you know how to do this? I'm really getting tired. I mean, seriously, I really need your help. Okay, so if you could get down across from me. No, you're fine. Okay, do you know how to do compressions? Okay, if you don't, I'll show you. But on the count of 3, we're going to switch, okay? 1, 2, 3. No, right here. Perfect. Just keep compressing. A little bit deeper, a little bit faster. Perfect. See the blood flow to the head? Now, your mannequins, a little bit of a workout, isn't it? Now, you can stop. Now, your bystanders don't need to leave you, okay? You're going to see how valuable these bystanders truly are. They're going to be your best friend in a few minutes because we cannot, and I do these classes all the time, people cannot last really past 2 minutes. A lot of people can't last 1 minute. You're switching off. You're asking for help. And you're going to see really quick that bystander, you need them. You've got to put on your big girl or your manly voice and ask somebody for help. As adults, we're horrible at it. Guess who is good at it? Guess what age group? Yeah, middle school and teenagers. They don't care. Yeah. They don't have any concept of lawsuits. We overthink everything, right? But you've got to start talking to people because you're not going to last for very long. So when you make that switch off in your group, have a seat. That way I can kind of tell who all's had a turn. Now you can weep and you can wail and you can be a little reluctant to get down here. You can start off doing it wrong, however you want to start. But I need everybody to take a turn if they can. If we're going to do this at the table, I'll help you out with that one because at the table, we're going to use this mannequin. Now, all these mannequins kind of look like this, but they light up differently. You can find your hand placement. You should see 2 green lights on the left shoulder if you're doing it right, okay? If you're doing it wrong, get a red light, right? So the goal is for you to keep 2 green lights as long as you can, right? Do people really light up in real life? Does that magical song, Staying Alive, start playing from the heavens? No. You'll know. I can't go any, can't feel my arms. I need to switch, right? You'll know when to start talking to someone. The problem with CPR is typically people don't push deep enough. So don't be afraid that you're going to hurt them. Because if you don't do something, everybody that knows this person is going to be hurt, right? So you got to look at it that you're doing more for him than not doing anything at all. Give him a chance, right? Okay. So we have 9 stations, 10 including the table. Do I have anybody that needs to use the table? Just so that I know. Okay. So what we're going to do, remember in grade school where we had to number off? Yeah, we're going to do that again. So station 1 starts here, okay? No, station 1 will start at the table. 2, we'll go this way. 2, 3, 4, 5. If you guys could help me kind of put everybody in the right station. So we'll number off. We'll get in our groups. And the first thing I want you to do in your group is just do a couple compressions. See what it takes, okay, to get this mannequin to light up. Now, this is good for adults or teenagers, right? So even though if you get a mannequin that says child, this is your teen. So, it's okay. So adults or teenagers, hands only works great on, okay? All right, any questions before we start? Yes? Then you need to try to get them down to the floor. Yeah. Yes? Typically, we're going about 8 minutes without doing, in some cases, an advanced airway. You got to remember, you can blow and blow and blow all you want to. But if you're not over here circulating, what's the point? So, and I don't know, you want to help me with this one? About passive ventilations a little bit, sort of, kind of.
Yes, there's some complex physiology, meaning how the body works, about when we are compressing the chest, about what's happening to the lungs, and about them filling as well. So actually, people spend their whole careers figuring this out, but the bottom line of what we've currently figured out is for the time being when someone is talking that just doing compressions alone. Complicated reasons why, but
right.
That's the bottom line.
Right.
If you want to know more, I can tell you.
Yeah.
High 40s.
Yeah. Any other questions before we get started? So I'm left-handed. So usually my dominant hand is first, and then I just kind of lock my fingers in. Now, if you're right-handed, this may work better for you, but I'm left-handed. This is what's sad. My patient's head always has to be to the left of me. So if he collapses this way, he's in trouble, or I'm going to have to go around the other side. No, I'm just kidding. But it's just what preference. And that's why when we first start, I want you to get the feel of it first. Find your hand placement, because you will see they will not light up unless you're doing it exactly right. Okay? Any other questions? Okay. Yes. The problem is, through research, what I think in medicine that they have found is that people don't push deep enough. There's that little blanket of fear back there somewhere in the recesses of our heads that are like, don't want to hurt him. So we don't push deep enough. That's the problem.
And my challenge there would be that for the most part, going too deep after a while is going to wear you out a little bit.
Yeah.
You're going to weaken out.
I mean, what's under the heart? The spine.
Rate, it's almost impossible to go too deep.
Right.
Because at that rate, you just simply can't. As long as the rate is correct, then you can focus on.
Right. Any other questions? You guys ready to sweat? Yeah. Okay. So we'll number off. This is going to be station 1, and what we'll do is, if you're switching off, yeah, if you need to do the table, you can just come on over here, and I'll work with this group. So if anybody needs to do the table, let's get you out of the numbering.
So if anybody needs to do the table, just come on up.
Yeah.
And then we'll start as station 1.
Station 1 is right here, and we'll just go around the room.
Oh, I wasn't in the Mannon area, but sure.
Okay, so we'll start numbering right here. So we only have 9 stations at this time. 9. So, group number 1 here, 2, our corner, 3, back here, 4 is right here, 5, 6, 7, 8 right here,
5. Check. The microphone is right here.